In now, that was the national picture. Specifically, what has happened in the last 7 days since the 20th? Where were we when we did the last briefing? When we did the last briefing, we had 2,400 confirmed cases in Gauteng. That is last week, Thursday. And out of those, we had 72% recoveries, which was 1,729. We had 27% active cases last week, Thursday, and we had 27 people who had passed on, which is 1%. At that time, it was 1%, to precise, 1.1% of the national number of people who have passed on. So, 8 days later, we have an increase over the last 8 days of 929 cases. And that's positive cases. That's the precise number of people who have tested positive in the last 8 days in Gauteng. The recoveries over the last 8 days have been at a 61% rate. The mortality rate has, precisely the case fatality rate has remained at 1%. It hasn't changed. And the number of active cases has also increased from 27% to 38%. We are going to be sharing with you. So, what has changed and where has this change come from? And what is it that our public health response is doing to intervene based on this data? Because our strategy is informed by evidence, it's informed by data. We are tracking what is coming through and direct our resources and energies accordingly. Every week we share with you this graph that shows basically the positive cases in our province. There was a long period where they were steady. The number of increases were steady, smaller, below 100 cases. You would see that over the last 8 days, in the last week, there's been a significant increase, and there were days where we were recording over 100 cases. We are going to show you precisely when. The number of recoveries, we always watch that. When there are more recoveries, it's good for us, but you can see the recoveries has leveled. That's not what we want. We want the recoveries to always be more. You can see the number of active cases has spiked. So we have the graph is inclining on the number of active cases. We're going to indicate to you what has happened in the last 8 days and where has this come from. When we look at the regional data. So we share with you here a picture of when we were in level 5, just before the national lockdown. Our province the numbers were shooting up daily. The daily infection rate reached 124 on the 28th of March. That's like the largest, just around the time of the start of the national lockdown. And it was a result of the pre-lockdown surge in the number of positive cases. So you would see from the national lockdown, level 5, we had a variation of between 50, 51 cases, sometimes even got to 9 cases a day. And we went up at the start of level 4, we went to 91 cases at the start of level 4. And in the last few days since the start of level 4, we have been, the number of cases, daily positive cases has been between 26, as you would see, and at the very most 75 cases. But on some days we were recording much fewer cases. But from last week, you would see from last week we started recording. We went back to 112 cases, particularly on the 23rd, May 23rd. We had our first largest increase in the number of cases. On May 23rd, we recorded 112. On May 24th, we recorded 100 cases. And on the 25th of May, we had our largest number of cases ever. That's 260 positive cases a day. And that so far has been the largest. The number came down to 50. We're sharing with you, we indicated to you that over the last 2 days we are back to 100 and something, 124 on the 27th and 162 on the 26th, and above 150 also last night. So you would basically, what is the critical observation you can make here is that over the last 8 days we have been recording the larger number of cases than we have had even before the lockdown. And it is important when we think about where these cases are. That's the next slide I'm going to share with you about the regions. So firstly, let's say to you, last week when we briefed you, last week Thursday, the regional picture, out of the 2,400 positive cases, the regional picture last week Thursday was like this. Johannesburg had the 1,238 positive cases with 1,036 recoveries and 190 active cases. You'd see, followed by that is Ekurhuleni, which has 549 cases that were positive cases, 395 recoveries, and 146 active cases. And Tshwane had, amongst the metros, Tshwane had the lowest number of active cases, which were 99 active cases, but 344 positive cases and 241 recoveries. I want to draw to your attention to 2 districts last week. So those 2 districts, Sedibeng, it's more or less still the same. In the next slide, I'm going to show you what has changed. And many of you would know what has changed. Look at where the West Rand was last week, just 8 days ago. Only 72 positive cases in the West Rand, 43 recoveries, therefore giving you 26 active cases. We only had 26 active cases in the West Rand. What has changed this week? So you can see, if you look at Johannesburg, look at Ekurhuleni, look at Tshwane, look at Sedibeng, the increases there have not been surprising. There's been no big surprise in any of those 3 metros plus 1 district. The increases have been steady. We are going to share with you today also where they have been coming from, which specific, no longer just sub-district, but also we will share with you which wards in each of our metros and how many cases in those wards. And if you say that we have had this 929 cases in 8 days, it is very important that our public health interventions are also informed by understanding where have these cases come from and why. And what is the source of outbreak? Is it a cluster outbreak? What's the source of that outbreak in that area for us to be able to intervene? So you can now see that suddenly the West Rand, coming from where 26 active cases, the West Rand now has 244 active cases. And most of these cases have happened in Merafong, that is that Mponeng mine that we visited with members of the media. You were there, some of you were there when we visited the West Rand and had a discussion with the mining houses. So the mining sector, so the story of this week is that the mining sector has contributed substantially 21% of all those new cases that have occurred in our province in the last 8 days have come out of the mining cluster. 21% of those. Last week we shared with you the sectors that are of great concern to us, the sectors which we have been working with, engaging, and we said to you, we had also been looking at the mining sector elsewhere in Limpopo, the outbreak there in Limpopo in a mine, and we said to you that we are going to be engaging the mining industry on this, and it has indeed happened in the last 8 days that more cases have come out of that. So the point is, last week we said to you we were concerned about the dynamic in Ekurhuleni, especially in the northern part of Ekurhuleni, a sub-district called Ekurhuleni North N1, North 1, and Ekurhuleni North 2. Basically, those areas in Ekurhuleni last week which were of concern are the northern parts of Ekurhuleni from Kempton Park right up to Tembisa, including the part of Johannesburg which is Ivory Park. Last week, when we said Ekurhuleni is a hotspot, it was a result of a cluster outbreak that basically came from a factory in Centurion, which employs a lot of people who live in Tembisa and Ivory Park. It is out of that factory. We shut down that factory already. By last week when we shared with you the information about our intervention there, we had already shut down the factory. We had tested the people in both communities, Ivory Park and Tembisa, and we had also isolated all the contacts in that area. I am happy that people have been recovering substantially. Those people who some of the test was done 2 weeks earlier. Of course, we know that some of the important things we are also dealing with is about, as we are quarantining people, we're also waiting on the results of the tests. So far, we have been able to contain that area. That is the area in Ekurhuleni and in the Ivory Park, Tembisa area, out of a factory which is called Farmhouse that employed 400 people, and out of that we tested the workers in that and found that there were workers who were positive in there and they live in the townships. We traced their contacts and we have been able to quarantine those. We are observing them. There are persons. They are called PQIs, persons under investigation. Am I correct, Dr. Suku? We are still watching those very well, very closely. And whilst Ekurhuleni is no longer the concern it was for us last week, the northern areas of Ekurhuleni, because of the containment measures we have put in place there. So the key focus is in the West Rand, correctly. So you would know that the President announced the hotspots in the country. Gauteng metros, the 3 metros in our province were part of the national hotspots. Tshwane, Johannesburg, and Ekurhuleni are still part of the national hotspots. And a hotspot is defined as a district that has 5 or more active cases per 100,000 population, or a district that has a high number of new positive cases over a short space of time. It could be over 7 days, or it could be over 14 days. Just at one go, a significant number of active cases. And on Wednesday, we did indicate that given what's happening with the mining areas in the West Rand, we ourselves have identified the West Rand as a hotspot because of the number of cases that we have in that area over the last 8 days. And a hotspot basically requires, once an area is a hotspot, so we have 3 hotspots in Gauteng announced nationally, the 3 metros, but the West Rand, according to us, requires that level of elevation to be made another hotspot with, so that we can do what? We can increase the level of vigilance over that whole area, including all the mining houses, and that is why we met with the mining houses, the 4 mining companies in the West Rand, to look at everything that they are doing, including ensuring that they will work with us, firstly on the number of cases that we have there, those workers who have tested positive, and secondly on all the contacts we have been tracing. We have traced over 200 contacts in the communities in the area, including putting in place safety measures just to make sure that we test more people. We are doing so, we are testing more people in the communities, but also working with the mines to test more workers in that area, so that we know the fullness of the spread of this. That's what we did in Ekurhuleni North when we had that cluster outbreak. When we have a cluster outbreak, we direct our resources there, test as many people as we can, and trace the contacts and quarantine those. We have done that also in the West Rand. We have quarantined all the contacts that we have been able to trace in the West Rand, and we are working with the mines to ensure that all the hygiene, health and safety and social distancing measures are put in place. But if you understand that what we are doing there in the West Rand is what we have done in the areas, even in the early hotspots, we always explain to you, our first hotspots were in the suburbs. We have learned a lot from dealing with those by making sure that in the suburbs it was easy to self-quarantine or self-isolate, but we had to do lots of contact tracing at that time and ensure that those contacts themselves are isolated or are in self-isolation. So as we move, what we call the shifting geography of hotspots, as we move, every 7 days we may have a new hotspot. And that's, I would like people to understand. Once an area is, even a local area, a community or a ward is defined or designated as a hotspot, it doesn't mean it will be a hotspot forever. It depends on the sort of interventions that are there. And very successful interventions lead to the containment in the area of the spread, leads to recoveries, the treatment of those who need treatment, who have tested positive. And in many areas in Gauteng, we have seen that the number of recoveries, people who would have tested positive, has been very high, on average 74%, and in some of our regions even much higher. And that's what our interventions in hotspots would be. So, but we now have, as a result of the measures announced by the National Minister of Health, we have also enhanced our hotspot strategy. Our hotspot strategy will go beyond what we used to do before, which was testing and contact tracing and isolation or quarantining. But now, because of the changing geography of these hotspots and the new dynamics, particularly the hotspots in the townships and in the informal settlements, they need a very different approach. We have, as a result of that now, we have teams at ward level, ward-based teams, and we are now every day when we receive information coming out of the NICD, announced by the minister, these are the number of cases you have in Gauteng. Every following day, we now look at those numbers, break it down, no longer just in terms of the districts, no longer just in terms of the sub-districts. We're now taking that, breaking it down into the number of people in every ward and in every community. To look at 2 days before, how many people were positive in that community and what has happened now. We are directing teams now, the ward-based COVID teams, which are multidisciplinary and multi-sectoral teams, which we are establishing in all wards in Gauteng. So we're now establishing, we reported to you last week that we have a ward-based strategy. We are now establishing ward-based, COVID ward-based teams. These ward-based teams will be multidisciplinary and multi-sectoral. They will include experts, public health experts. Amongst those would be the Cuban Medical Brigade and our local public health experts who are operating at our primary healthcare system. They will also include community healthcare workers. So at every ward we would have a team that's looking. So every other day we do a breakdown of the number of positive cases in your ward. And this information is now getting sent back to our ward-based teams. We have been establishing these ward-based teams in the last 7 days to manage the next phase of the pandemic's trajectory and progression, especially in the areas that where we have high density numbers. It would not be easy to cope by using the strategy we have used earlier on, where the pandemic is in the townships now. We need a ward-based response, including at ward level to identify areas of high risk, shopping centers, shopping malls, public transport nodes where people are not observing regulations, are not observing social distancing, they are not wearing masks, spaces where our children play, spaces where people who would like to exercise are doing that. So we also want to make sure that at that ward-based level, we also include community leaders, sectors who will be represented, various sectors at the ward level. Because to tackle this pandemic at the scale that is required, it cannot just be government alone. Especially to get our people to change behavior, it can't be the police who go around policing the behavior of people. We would like social mobilization at community level for many people to understand, and leaders, including now that we are going to level 3, we're going to have various sectors of the economy open. We're going to have the religious places of worship, religious facilities will be open. So the ward-based team approach will also help us in ensuring that every place of worship in that ward, every public school in that ward, the schools are opening, every open space in that ward, every transport node in that ward is also monitored, as I said, including shopping centers and the spaza shops where our people come together. That this is a collective effort to ensure that we all comply with the measures, the hygiene measures. But the ward-based teams are also attending to other ailments. Those ward-based teams will also be dealing with the work that our teams ordinarily do. Our health team with the NGOs deal with HIV and AIDS. They deal with TB and other chronic diseases. So these ward-based teams will not just be dealing with COVID-19, because we know comorbidities are very much responsible for most of the death. So we don't want to ignore that. So if you want to understand the Gauteng hotspot strategy, is that it is a comprehensive strategy, firstly based on data. On a day-to-day basis, we receive this data, we break it down into the minute granular level, ward level, how many cases in that area. We also want these ward-based teams to be able to provide support to those who have tested positive. Instead of allowing the stigmatization of COVID-19, these ward-based teams will also be able to ensure that communities understand when you have COVID-19, you need support, you are still human, you will recover, yes, some may pass on, but we want to ensure we deal with stigma as well. We also want to use these ward-based teams will help us direct properly the efforts of where food support needs to go. You know, in terms of food, our food supply, we were having a general approach that's based on where the need is, but now we want to direct it also to where the problem of COVID-19 is. A ward that has got more COVID-19 cases in an area of high vulnerability where many people don't work, where many people are hungry, that ward will also receive more support from food security interventions, as well as other overall government support. So we now share with you data, some granular data that says to you in different areas of our province, in the different metros. In Johannesburg, we show you the data that shows you that a certain part of Johannesburg that included Four Ways, Diepsloot, Kayasent, Dainfen, Midrand, up to Lanseria was designated as a region in Johannesburg. It's Region A. That region was a big concern in the earlier days. But you'd see they only have 17 active cases at the moment. So whereas they've had 202 positive cases, they only have 17 active cases. The recoveries are so substantial in that region. Yes, we are continuing to monitor the areas there, even in that region, like Diepsloot, very closely, Kayasent. So we are showing you region by region. In Johannesburg, that's a sub-district. You go to Ekurhuleni, where were most of the cases. You would see what we said is it's Ekurhuleni 1, and Ekurhuleni, that's N1, that's the northern parts of Ekurhuleni, and the N2, both northern parts of Ekurhuleni, and Intswane. We're also showing you where most of the active cases are so that we can make our interventions. But you will now see, in that same, we show you that the West Rand, again, the sub-district called Mirafon City, that's where the mining outbreak has taken place. That sub-district has 130, in just one area, 130 cases have happened in one specific area. If you add them with that 83, that's where we have more than 240 active cases. So in 1 week, basically, you can have an area where the cases were few. In 1 week, that could change into many more cases. And that helps drive our interventions. We're also going to be doing this regularly to say to you the top 20 wards in Gauteng. In other words, the top 20 wards where we have more cases. And I want to explain to you that by more cases, sometimes the cases they may appear few. Look at Carltonville. This is what the Mirafon, the mining area. So you may have a ward there that has got 23 cases. But if you take the whole area as a sub-district and add those cases, there will appear more. So we don't want to wait until an area, a ward has got too many cases. That's the point I explained last week. And once we identify that in a ward there are this number of cases, very often for us 10 is big enough. When we have 10 cases in a ward or in a community, 10 is big enough to require a significant intervention from us. And you'd see we even track up to 4 cases in other parts of our province and our municipalities. So this is also changing. So the top 20 wards in Gauteng that have got more cases is something that is changing every week. Next week, we may present a different picture. You may find that there are a lot more recoveries in these wards, and another area has emerged as a hotspot. We will do the same. So when I said to you that we want ward-based teams that have information about where to intervene, to inform our testing strategy, to inform our tracing strategy, to inform where we need quarantine and isolation resources, to also inform where we are going to need more beds, people who may need hospitalization. This is based on data that's now being drilled to that level. We are further sharing with you the different wards. Again, the numbers may appear quite small, the number of infections. The point we are making here is that in this province, we are not just embarking on a program or a COVID-19 project without being informed by data. We are driven by that and interventions that we have to make. Every day when the results come, we sit down and do a breakdown. Where are these new cases coming from? What is it in that area we have not been doing, and what is it we can do to ensure we contain the spread and ensure that we protect an area that may have been green as of low infection rate. It's also our concern, like Sidibeng district has been a low infection rate district. We also want to make sure that in the areas where the infection rate has been low, we protect those areas by these non-pharmaceutical interventions that include continuing to ensure the social distancing in that area, hygiene measures are implemented, and all the health protocols are implemented in those areas. We map them. It's not enough just to give you the raw data. We also map this with geomapping. The geomapping of all cases in Gauteng is something we do very well. The size of the dot on our geomap will show you that it is emerging as an area of big concern. So just look at that Carltonville area. The dot is much bigger, and the dot indicates the number of active cases. You would see that Ivory Park area and the parts of Tembisa is where we were concerned last week. But those dots you see, those dots are smaller than the dots, the size of the dots in the West Rand, in the Mirafong area, because of the intervention that we are putting in place to contain that. And some parts of Soweto are included in that. Some parts of Soweto, including the Dobsonville area of Soweto, on the western side of Soweto, right up to Protreatland on the south, you would see the number of positive cases, but also we're getting recoveries out of those areas as well. So mapping where exactly these cases are is also very important to inform our interventions. I want to run through this usual update. There's a number of people who have been immunized in the last 8 days. There's 10,000 more people who have been immunized compared to last week. And again, with immunization is targeting those who are most vulnerable. We don't just immunize everybody. Firstly is the public health workers themselves, the elderly, the children, pregnant women, and people who have chronic diseases, including those with HIV and AIDS. Screening, we have now screened 5.6 million people. Our target was to screen 5 million people by the end of May. If you may remember, those of you at the beginning of May, we said to you that we want to screen 5 million people by the end of May. We have surpassed that target. We had said to you we want to be able to test 3,000 people a day. We have surpassed that target of testing. There are days that we test over 6,000 people a day in Gauteng, just as government, and this testing is targeted. Of course, I think we are concerned, like all provinces, we are concerned with the backlog on the results, and that's a matter that is being attended to by national government. The testing figures, we always give you an update on the testing figures. We get these figures overall, the national testing figures, we get them from the National Health Laboratory Services. Again, Gauteng contributes 33% to the overall national tests done so far, at 215,959 tests done so far. There's an important information that was released by the minister yesterday, which indicates the number of tests have increased. That 209,000 for Gauteng was the day earlier. We've just given you an update, including what is captured is only what's called community screening. Contact tracing, our province does extremely well. I'm going to give you an update on hospitalizations. The number of deaths remains the same in comparison to the rest of the country, other provinces. That's the national information released yesterday. So let's give you, as of today, an update on how many people are hospitalized in Gauteng. As of today, there are 203 people, 203. 173 of those are in the private sector and 30 are in the public sector. So there are 203 people who are admitted in our facilities, both private and public at the moment. 173 are in the private sector and 30 are in the public sector. 5 of them are under ICU, they are in ventilation. They are under a ventilator, and others are on oxygen, basically. We have a full breakdown there, including on room air. So, on average, the number of people, every 7 days when we brief you, we have had, on average, 72 people in our hospital. You can see the number of admissions has increased, and it is a matter that we watch very, very closely. So when we have the large number like this, relatively larger than we have ever had before, it is a matter that we watch very, very closely, because it is out of the hospitals where we have people who recover and others lose the battle against COVID-19. So that's an important area. The number of people who have passed on is still 31. Again, this looking at the hospital admissions is important because clinical interventions happen there. Our clinicians spend a lot of time doing tremendously great work to ensure that they save life, even those who are admitted in hospital, and a lot more of them are able to recover and get back to normal life. The number of beds that are currently available in the public and the private sector, that number has not changed, 8,301. Additional number of beds have changed only slightly. We took you to the Ashanti Gold Hospital. That hospital, we had targeted 200 beds in that hospital that is being refurbished. We took you there on Wednesday. But the design of everything there, the number of beds have been revised from 200 to 175 beds. So initially our plan was to have 200 beds in that hospital. But because of the design, when you do ICU beds in particular, the design is different. So we have lost 25 beds out of that redesign. So the rest, the work is now underway, that work of refurbishing and building additional beds with alternative building technology in the various facilities in Gauteng province. Our PPE stock, you would see it there, it was 11.4 million. It has gone down to 11.2 million. But we always have to have stock on order in anticipation of more work, including in anticipation of the peak that is still ahead of us, so that we have enough stock on supply. I just want to give you an update in terms of the number of people. Since the start of the national lockdown in Gauteng province, we have distributed 166,349 food parcels across the province, covering 831,000 people in Gauteng. We want to reach 1 million people, and we are confident that we will reach 1 million people soon. Every week when we update you, we have additional number of people. Now we are diverting all this intervention, diverting them to areas of high risk and areas of vulnerability, including where we are now getting new cases coming, especially in the townships and the informal settlements. The number of the homeless people we are providing food to is still more or less the same, 3,126 people receiving 3 meals a day in the 47 shelters for the homeless in Gauteng. Last week we shared with you extensively the work we are doing with business. The only update we can give to you is that the mining sector has been our main focus. We continued this week to also to engage with the shopping malls in Gauteng, and we are classifying the level of compliance of all the shopping malls, designating them as green. Green is full compliance. Amber is the one, a shopping mall that has got some significant compliance, but not 100%. But red is a mall that's not complying, and in those cases we are moving in. Where we have a mall that's not complying at all, we are moving in with law enforcement to ensure that if they don't comply, they basically have to shut down. So we have done a lot of work to look at compliance with level 4. We have done a lot of work to prepare for level 3. We have done grading of malls, as you would see them there, indicating which ones have been a problem for us and which ones have done better across the province. And we are doing checks, regular checks, not once-off checks. We are doing regular checks to just make sure there is a full compliance with the sector. These are some of the businesses where we had a problem. Farm-wise is the company that I was talking about in Centurion, where there was a cluster outbreak which caused problems for us in the Tembisa Ivory Park area, which got us to have significant new infections in that area. We made an intervention there, and we've also been looking at other businesses that are complying that we have visited so far. I would like at this stage to ask MEC Lesufi to do an update on the schools in terms of the readiness for the schools to reopen on the 1st of June. MEC Lesufi, please come and do an update